Hi, today I'm going to speak on the psychosocial management of substance abusers. So, when we say about substance abuse, as we know, there are various forms of substances, from alcohol, which is a depressant, to narcotic analgesics, tobacco, which is widely known, nicotine, widely known, then we have LSDs, then we have heroin, which comes under narcotic analgesics. So there are various forms of substance abuse. And so I'm going to talk to you regarding management of substance abuse. So when we say about substance abuse, we manage into factors, knowing that psychological and social factors both go hand in hand. So if a person is rebellious in nature, if there is sense of inferiority in a person, if you see a person with poor impulse control, low self-esteem, or inability to cope with the pressures of life and also the society, life is demanding too much, or family is demanding too much, he is not able to take it, loneliness or unmet needs, desire to escape from reality, desire to experiment a sense of adventure, pleasure-seeking behavior, sometimes to show as machoism, or sometimes just to try with sex. So if a person gets into an altered sensorium, then it becomes easier to go for such kind of an conduct. So these are psychological factors, and there are also social factors like religious reasons or peer pressure. Like in certain communities, it is very acceptable to toast with a beer or toast with champagne, which is acceptable drink. So in those kind of religious ceremonies, this is quite normal. Sometimes we also see nowadays, because of the urbanization or because of the satellite families, that means hardly one or two people living in one flat. So the minds are also very liberal, and then alcohol or drugs become a part of life. Extended period of education, the person was supposed to finish in a definite period, he could not, and then it went on that he would rely on substances and it becomes a habit. Sometimes because of unemployment, overcrowding, or poor social support, effects of television or mass media, like too much of booze and too much of videos which comes in mobiles or in any kind of social media, Facebook or in Insta, or if it is shown in a very lucrative way, then a person feels like, with an impulse that let me go and buy a drink. Sometimes occupations are also sometimes hazardous, like a person working as a chef, barman, executives, or salesmen, or doctors, or medical personnel, journalists, corporate personnels, entertainers, army. So these people, they're prone to have a community feeling or social gathering. In that social gathering, so it becomes a habit. So to say about the process and the stages of alcoholism, there are 4 stages basically. Experimental stage. Everyone starts with experimenting themselves. So that phase is called as experimental stage. Next is in recreational stage. So he takes it from once in a while, sometimes in 15 days, sometimes in occasions, in bihu, puja, etc. And then it goes into a relaxation stage, when he starts saying that I feel relaxed while I drink, or this is the best pastime, I do it alone. So then it comes to a relaxation stage, and the last is called as a compulsion, that he gets so habituated that he can't live alcohol, and that becomes a double door kind of a phenomenon. So first use to the last, it will go into a dependency. So as the stage progresses to a crucial stage, from chronic stage, then a person has to go for rehabilitation, and then last is called as relapse or a road to recovery. So in the stages of motivation given by Francesca and Clementa, so there are again 6 stages. So first stage is called as pre-contemplation stage, contemplation stage, determination or the preparation stage, action stage, maintenance stage, and relapse or road to recovery. So in pre-contemplation, person is in total denial. He doesn't want to take treatment. In contemplation, he comes in terms because of the family members, or sometimes because his liver or some kind of physical problems are being shown in the body, or pancreatic problem, high diabetes. So these could be some of the reason that he has come across to meet the medical personnel, and he found that he needs to take also treatment for his alcohol. So here he is in an ambivalent, whether I should leave alcohol or I should not leave alcohol. Next stage is called as determination or a preparation, planning stage. Here, from the day he takes treatment to 3 months, if he is motivated enough, then it is called as determination or preparation stage. Next is the action stage, where he acts upon his cause, that I'm going to leave alcohol. I'm not going to leave, I'm not going to follow the previous rules of drinking. So this is between 3 to 6 months, and this is called as action, and he's very active. Next stage is called as maintenance stage. That means he keeps strong as he promises that no to drinks, and he's sober. So this is called as over more than 6 months. And next is called as the relapse. So sometimes what happens is he just feels that let me go and have a drink. Then it is called a slip. Then he has it for 1 week and he stops. Then it is called as relapse. But he drinks again and again. Then it becomes a relapse, and he goes again to the 0 stage, and again he starts again in the treatment process. So to see the therapy, it is 2 types, or rather more than 2 types. Psychological therapy, that we start with motivational interviewing, then group therapy, when all the people with the same problem sit together, and family members also sometimes sit together, all the family members sit together. This is called as group therapy. Then there is certain aversive conditioning. There are certain areas that we do not ask the person to go. So these are kind of aversive conditioning. And cognitive therapy also is given to a person with substance abusers. So there are also relapse prevention techniques. Like the technique helps to the patient to identify high risk relapse factors. Like for example, when he goes and meets a particular friend who taught him to drink. So we will avoid that kind of a friend. Or if he used to drink in a group, in the same place, or an alcohol booth, then we will ask the person to be away from such kind of people. Cue exposure technique, that is the technique aims through repeated exposure to desensitize the drug users to drug effects and thus improve the ability to remain abstinent. Assertiveness training. There are a lot of people whom we see are people, those who have poor self-esteem. When he drinks, he can talk better or he can perform better. In those kind of person, alcohol consumption or drug consumption is seen more. So in those kind of people, we ask them to take assertiveness training from trained professionals like us, who's either a psychologist or a psychiatric social worker. Behavioral counseling, supportive psychotherapy, and individual therapy go hand in hand for the psychological therapies. Another aspect is called as social therapy. In social therapy, there is Alcoholics Anonymous. So this is a fellowship which is started long back in 1985 by Bob and Bill Wilson, and later on this became an important fellowship in worldwide. So Alcoholics Anonymous considers alcoholism as a physical, mental, and spiritual disease, and a progressive one, which can be asserted but not cured. Members attend group meetings usually twice a week or in a holiday once in a day in turn. So each member is assigned a support person from whom he may seek help when the temptation to drink occurs. Another important criteria of Alcoholics Anonymous group is that they come together in terms of crisis. When a person is going to relapse, if his family member calls up the mentor, then he would come immediately in help of the person who is going to relapse or going to have a problem of drinking again. So what is a relapse? Relapse refers to the process of returning to the use of alcohol in the same pattern which he had long time back. So relapse dangers could be that the presence of drug or alcohol users place where they put the drugs together. There are a lot of negative feelings, anger, sadness, loneliness, guilt, fear, and anxiety in the persons. Positive feelings which make you celebrate, but boredom or feeling bored, that also may lead to relapse. Increase in the drug intake, physical pain, or sometimes with lot of cash if a person lives, then he feels like what to do, where to throw the money. So he would rather go and buy drinks or spend in nightlife and all these aspects. So how to manage relapse? Like, first of all, we have to know what are the warning signs of relapse. If a person stops medication, then we understand that he may go into relapse. Hanging around old drinking haunts or drug or friends, those who were old friends, if they are started again mingling together, then it could be because of that he might go into relapse. Or sometimes if he's isolating himself, or he's a person who used to be he used to have lot of friends, but now he has stopped having friends, then that also could be one of the reasons. Or obsessive thinking about using drinks. If that thought comes in again, then he will go and have it for a time. Fail to follow their treatment plan, quitting therapy, skipping doctor's appointments. Feeling overconfident, difficulties in maintaining the relationship, setting unrealistic goal. Sometimes again breakups or divorces also leads to relapse. Changes in the diet, sleep, energy levels, and also personal hygiene. Feeling sometimes overwhelmed because of too much of success, that also person may relapse. Constant boredom, sudden change in psychiatric symptoms, unresolved conflicts. A person might have different kind of psychiatric. He may be a person already who had psychiatric illness, and now he has also started with drinking or with other substances like nicotine, tobacco, etc. Sometimes people who avoid people, that could be also one reason for relapse. Major changes of life, like I said, one like divorce or break off, loss, grief, trauma, painful emotions, winning sometimes lotteries. These are major life events that changes a person's life, then also relapse might occur. And ignoring the relapse warning signs and symptoms. What are the consequences of substance abusers? Commonly leads to physical and physiological dependence or both. Causes unhealthy lifestyles and behavior. Chronic substance abusers impairs the social and occupational functioning, creating the personal, professional, financial, and legal problems. Drug use is in early adolescence leads to emotional and behavioral problems, including depression, family problems with relations, failure to complete the school, or chronic substance abuse problems also jeopardizes the pregnant women because of the fetus. Long-term effects would be psychosis. Intravenous drug users leads to life-threatening complications. Illicit street drug users also might get spurious drugs. There are various forms of assessment. So in acute management, care of substance abuse patient start with assessment, like we use readiness to change questionnaire or masked Michigan alcohol screening test, or we may use CAGE, which is very, very easy to apply, cut down the alcohol. So during the acute phase of drug intoxication and detoxification, maintaining the patient's vital functions, ensuring his safety and easing discomfort. During rehabilitation, caregiver helps the patient acknowledge his substance use problems and also find alternatives how to cope with the stress and help the patient to achieve the recovery to stay a drug-free life. So the family members and the one who is close to the person who is a substance abuser, he needs to be empathetic. He needs to focus the goal of himself as well as family, and also allow the person to make certain choices, like how much to discuss, when to discuss. Talk does not mean change, but decisions also to be facilitated among the substance abusers. So assessment, we give a feedback, then choices are asked to be made, responsibility is given, family involvement, and then we follow up. So handling the substance abusers, it would be in an acute way, like need to be made self-aware. The patient needs to be made self-aware and understanding the positive attitude towards the patient. Control reactions to the undesirable behaviors, like commonly during the physiological dependence. One needs to understand the manipulation, anger, frustration, or alienation, and setting of limits and dealing the manipulative behavior. There are various ways how to handle, like coping, behavior counseling, cognitive behavior therapy, supportive as well as individual psychotherapy. Alcoholic Anonymous group, which I have already said, motivational enhancement therapy, then high-risk situations should be avoided. That also has been covered. Drink refusal skills, like assertiveness training or delay, distract, drink water, deep breathing has to be practiced. D's. And dealing with the faulty cognition. So community level, we need to handle the negative mood state. Time management is important. The anger control is important. Financial management is important. Developing the work habit, stress management, sleep hygiene, recreation and spirituality, family counseling would be very, very beneficial to maintain the interpersonal conflicts. So last would be that why not to prevent such a thing? Why to come to a tertiary sector like hospital? It can be way handled in a way before. So strengthen the individual personal social skills to increase the self-esteem and resistance to the peer pressure. Health education in college level itself can be done, and overall improvement in the socio-economic condition of the poor population can be addressed. So we can limit in such kind of situation. Thank you so much.